So now we will talk about the cardiac chest pain that comes from a cardiac origin versus the chest pain that's non-cardiac. So when you have a patient comes present with chest pain, there are many possibilities. What you will need to be thinking of is you need to prioritize the etiologies of chest pain can be prioritized based on their seriousness, how and the consequences of these etiologies. And so it makes sense that the first thing you want to be thinking of is if these etiologies or the consequences of these etiologies affect vital organs or life threatening, in other words. So the first thing that you should ask and could come to your mind is this pain of a cardiac origin? So, and the classical thing so you have to be thinking, does your patient present anginal type of pain? Does the pain radiate? Are the characteristics of this pain of a typical chest pain that comes, that frequently caused by cardiac origin? Any other symptoms that can support that this is a cardiac chest pain? One of the other things that you should consider is, does your patient have risk factor or factors that can lead to coronary artery disease? If any of this information are there, you need to believe that this is possibly a cardiac chest pain. And then to confirm that or to rule it out, we have to do the next step, which is do a chest x-ray, ECG, or troponin. Other symptoms could be pulmonary embolism can cause that. So if that is the case, we need to do a CT scan, a D-dimer to confirm that. So that would be your second. But it could also be caused by pneumonia. So when you do a physical examination, if you find dullness to percussion, if the patient has fever and other symptoms, signs and symptoms of infection, chest x-ray can help in this case. Some patients with anxiety attacks and panic attacks also come to ER complaining of chest pain with palpitation. So if we find in the history that they have been, especially within the last 6 months, a lot of stress going on, a lot of panic attacks, that could be another reason. And of course, all this after you rule out the cardiac or pulmonary issues. Some patient, it could be musculoskeletal. They have an infection or muscle spasm in the thoracic area. And classically, this pain increases with breathing or with palpation. Now, the cardiac pain, because it's from inside and cardiac, doesn't change with breathing or palpation. So that's another way.